Hi, Mike Gibson here with Snackable Health, and I'm joined by my good friend and colleague, Clive Meanwell. Clive, you and I have talked before about how we all want a Ferrari, but we really can only afford maybe a Hyundai or something. And the same is true in drug development. You know, we have a lot of very expensive biologics that no one can use. I think you have an interesting story about how you're trying to take something that could be repurposed and be very useful, not in the original intended disease state, but for something with tremendous unmet need. Asthma, talk to us a little bit about what you've been up to.
Yeah, well, we created a company called Population Health Partners to take on that problem of making Hyundais more accessible, easier to use, and lower cost. And we came across asthma, which is a huge problem around the world. 250 million people have some degree of life-changing asthma. Here in the United States, 25 million people. A lot of disease. Much of it, more than half of it, is caused by inflammation in the lungs that is sort of permanent, caused by little white blood cells called eosinophils. And amazingly, some of the big pharma companies developed some great biologics for that, injectables that you could give once a week, every 2 weeks, once a month or more, and lower those eosinophils so that the inflammatory state of the lung, which of course these days we all understand because of COVID, that the inflammatory state of the lung goes away. And so their ability to handle pollen and other things that might precipitate an exacerbation of asthma gets reduced. So great progress. The problem is they're so expensive, tens of thousands of dollars a year, only manageable by specialists, require injections, not accessible. Unless you have great insurance or you're independently wealthy, you just can't get these drugs easily. And so we came across a small molecule, a normal tablet, if you like, you could give a couple of times a day or possibly once a day in order to do exactly the same thing. And obviously making a small molecule tablet is likely to be a lot cheaper than making a very fancy, difficult to make biologic, which opens the doors for cost shifts. And then we're going to do trials which will include people at various stages of asthma in the hope we can show that they never develop this inflammation in the first place, or if they do, we can reduce the number of exacerbations they have. So we're launching some big phase 3 trials. We've already got agreement with the FDA how to do that. And we're hoping to do it in a primary care environment where patients will have more access. And hopefully, if we're able to launch it at a lower price, a lot more people can get treated. So more Hyundais, fewer Ferraris.
And are you going to sell the Hyundai to the government or to the individual?
You see, this is the big evolution. I mean, obviously what COVID has taught everybody is when there's a big population problem at stake, the government has to play a role in systematic purchasing. It's not common around the world except for vaccines, but we have done it previously in another company with inclisiran, the drug you know, with the British Health Service. We're hoping that we'll be able to look at those kinds of deals in the future as well. At the end of the day, the health systems want a lot of value for their money and are willing to talk to you if you take a population approach. So I'm very optimistic about that, but there's a lot of work ahead to sort of sort that out. Yes is the answer. Let's see if we can make it happen.
Great. Well, good to see you taking something that wasn't being used and using it for hopefully something very effective for very, very large numbers of people. And hopefully you'll break the model again and approach this from a population health perspective and do what you did with inclisiran and hopefully make this much more accessible. Clive, thank you so much for joining us today. And thanks to all of you for tuning in here to Snackable Health.